Hi there and welcome back. Let's review inflammatory bowel disease IBD, Crohn's disease and ulcerative colitis. They both are, although similar symptoms, but we'll get into the details. There are differences between the two, labeled as inflammatory bowel disease. Crohn's disease, named after Dr. Crohn and a couple of other colleagues, belongs to a group of conditions known as inflammatory bowel disease. Crohn's disease is a chronic inflammatory condition of the GI tract, gastrointestinal tract. It is important to differentiate between the two. The Crohn's disease is not the same thing as ulcerative colitis, although they both are type of IBD. The symptoms of these two illnesses are quite similar, but the areas affected in the GI tract are different. So, in Crohn's disease, it commonly affects the end of the small bowel or the ileum and the beginning of the colon. But it may also affect any part of the GI tract from the mouth to the anus. Ulcerative colitis is limited to the colon, also called the large intestine. Crohn's disease can also affect the entire thickness of the bowel wall, while ulcerative colitis only involves the innermost lining of the colon. And in Crohn's disease, the inflammation of the intestine can skip, leaving normal areas in between patches of the diseased intestine. Whereas in ulcerative colitis, there is a continuous involvement. So with that, let's look into the causes. And the causes are unfortunately not well understood, but it is believed that diet and stress. Likewise, in addition to that, some research suggests that hereditary, genetics, and environmental factors contribute towards the development of the disease. Now, it is important to make a note here that IBS, or the irritable bowel syndrome, is not same as IBD. The IBS, or the irritable bowel syndrome, is a disorder that affects the muscle contractions of the colon. And in IBS is not characterized by intestinal inflammation. So that's the important difference. Now, let's look at the signs and symptoms. Again, it depends upon the GI location involved, but given there are many similarities, so commonly encountered symptoms are diarrhea, weight loss, blood in the stool, abdominal pain, frequent bowel movements with small volume, incontinence, and fever. So, now the question is, how do we diagnose the Crohn's and or the ulcerative colitis? And quite honestly, due to the overlap in the symptoms, it is often difficult. But generally, the C-scope or the colonoscopy and the biopsy plays a big role. And there are some literatures to support that, and I am not going to even dare to pronounce this, but ANCA is a specific for ulcerative colitis. Likewise, ASCA is a specific for Crohn's. So with that, let's talk about the complications. In Crohn's, it includes abscesses, obstruction, fistulas, perianal disease, and even cancer. Whereas in ulcerative colitis, it includes bleeding, perforation of colon, toxic megacolon, post-surgical pouchitis, and of course cancer as well. Extraintestinal complications for both Crohn's disease and the ulcerative colitis includes arthritis of joints, hepatitis, cirrhosis, just to name a few. I did not mention here, but as far as the treatment goes, one size does not fit all, and it may require medication and or surgery and or both. So what about the underwriting? For the Crohn's disease, watch the colon involvement, extent of inflammation, and severity of inflammation. And for the ulcerative colitis, pay attention to the involvement beyond rectum and sigmoid colon, plus duration of the disease and malabsorption, and plug all these details into your company specifics and your company manual that your company expects you to follow, okay, to arrive at the appropriate grade class. Suffice to say, as far as the IBD goes at intro level, let's take a break here and see you soon. Take care. Bye now.